this part of the series, I will review with you the ultrasound evaluation of the elbow. We'll talk about the technique as far as patient positioning. I will review some of the basic anatomy, and will demonstrate the ultrasound anatomy. And finally, I will give you some clinical correlations at the end. When evaluating the elbow with ultrasound, you want to make sure you have a high transducer in the range of 10 megahertz or greater. I like to have the patient seated on the examination table, and I'm usually seated next to the table, or in some cases I actually stand. The elbow is examined in full extension, especially when looking at the ventral scans, and then the elbow is placed on the patient's thigh with a 90-degree angle when looking at the dorsal scans, and I will demonstrate that for you as well. As always, when performing ultrasound, you want to obtain all of your images in a longitudinal and a transverse orientation. Let's first look at some of the basic anatomy. Remember that the elbow joint is comprised of the humerus, the radius, and the ulnar. A close-up of this area, you will see that on the medial aspect, you have the medial epicondyle from the humeral head, and then it articulates with the ulnar. On the lateral aspect, you have the lateral epicondyle, and then articulation with the radial head. The posterior aspects of the elbow reveals the articulation of the humerus and the ulnar. In the area of the olecranon fossa, you have the bony projection of the olecranon, and in patients with olecranon bursitis, you may see some areas of inflammation that can be documented on the ultrasound. A close-up of this area shows you the articulations between the medial aspects of the humeral head with the ulnar and the lateral aspects of the humerus with the radius. There are 8 standard scans that may be performed to evaluate the elbow of patients. The first is the anterior humeroradial longitudinal scan, the anterior humeral ulnar longitudinal scan, and then the anterior transverse scan. Then you next want to go to the posterior aspects of the elbow, looking at a posterior longitudinal scan, a posterior transverse scan, and then to examine the lateral aspects and the medial aspects of the elbow using a lateral longitudinal scan and extension, and a lateral longitudinal scan and 90-degree flexion. Finally, you will look at the medial longitudinal scan. To start with the examination of the elbow, some examiners like to have the patient seated on the stool and have the arm stretched on the examination table. With the model today, I've chosen to have her sitting up, and I do this in the clinic as well, on the table with a pillow under the outstretched arm. I have also chosen to use the 12L transducer and have the frequency set at 10 megahertz. And let's take a look at the elbow. We first want to take a look at the articulation of the humerus with the ulnar on the medial aspect, and then we will look at the articulation of the humerus with the radius on the lateral aspect. So I'm putting it right over the elbow joint and focus on the bones, and we'll identify some key bony structures here. The first bony structure that we see to the left, which is more proximal based on where I have the notch on my 12L transducer, is going to be the humeral head. Then we actually can see an area of anechoic signal, this dark area here, which represents the articular cartilage. And then we see the hyperechoic signal coming from the fat, some more area of anechoic signal where the articular cartilage is, and then the ulnar head. I'm going to maximize the view of that area. If we focus in a little bit, and freeze in the structure. So again, humeral head, articular cartilage, fat pad, articular cartilage, and the ulnar head. For the next scan, I will look at the anterior humeroradial joint and a longitudinal orientation. We will simply move this transducer to the lateral aspect of the arm. This is also a very nice image where you can readily see several key structures. A nice view of the humeral head, which represents this portion of the transducer, the articular cartilage, the fat pad, articular cartilage again, and then the squared radial head that we see. This is a good area to look at if patients have rheumatoid arthritis and you're looking at for evaluation of synovial thickening or for erosions that might be readily obscene in that region of the elbow joint. After performing the longitudinal scans on the medial and the lateral aspects of the elbow, you simply want to go to do an anterior transverse scan. And the key structures that you identify here are some of your bony margins and looking for the presence of a nice, smooth, articular cartilage surface. You will also begin to see that you can see some of the blood vessels in the arms. So if our orientation is correct, we know that the lateral aspect will be to the right of the screen and the medial aspect will be to the left. And so we're essentially looking at the articulation of the humeral head with both the radius and the ulnar. And you can scan that whole transverse joint, looking for presence of joint space narrowing, looking for effusions, and looking for bony erosions. Next, we will change our orientation and look at the posterior scans of the elbow. I will next move to the posterior scans of the elbow, and let's first talk about the patient positioning. So in this case, I have the model, she swung around, and we'll have her to put her elbow flex out with the hand on the thighs and the thumb pointing back, and the elbow at a 90-degree angle. And that way I can very easily get to the posterior structures of the elbow. Again, I'm using the 12L transducer, and I have my frequency set at 10 megahertz. As far as positioning, you want to go directly over the bony landmarks representing the olecranon. And then what you will see on the ultrasound image, a very nice outline of the bony articulations. Again, the notch in the probe is pointing proximally. This is going to pick up the humerus. And the distal portion is going to go through and pick up the olecranon. In between that area, remember from the anatomy image that you have the olecranon fossa where the articulation occurs. And this is the area where you may see fluid in patients who might have an infected bursa or an inflamed bursa. So to illustrate that on the ultrasound image, this is going to be the humerus, and this will be the olecranon there, rep from the ulnar. And we'll get a better image of that on the live model. One of the key things about ultrasound is that you have to have the transducer at a 90-degree angle, and with very, very fine motions, I can actually focus on the tendon and focus on the bone and making sure I am not overlooking any significant areas. So again, to the left is going to be the humerus, olecranon fossa, and just before I go off the edge of the elbow, I will begin to pick up the olecranon portion of the ulnar. For the next image, we will now go to the posterior transverse scan. And again, if you think about your orientation for this image, and then looking at the anatomy model, on the lateral aspect, you will pick up portions of the radius. On the medial aspect, you will pick up portions of the ulnar. And then you might even see some of the articulations with the humerus. So looking at the ultrasound over here, we're picking up the medial aspect. This is going to represent the ulnar. I can see the space in here, which is the articulation between the ulnar and the radius. And over here, we pick up the squared surface of the radial head on the lateral aspect of that. You can, in this area too, see a small area of articular cartilage. There's not a significant synovial area in these individuals unless they have inflamed arthritis, such as rheumatoid arthritis. I will now look at the lateral longitudinal scan in full extension. She simply just dropped the arm, fully extended. I'm going to follow along the lateral portion where the area of the thumb is. Looking for our bony landmarks, the most proximal bony margin we will see is going to be the humerus as identified in the anatomy picture. And then next, below that, we should see the margin of the radial head. So if you focus in this region of the image, the first bony image that we see is going to be the humerus. And as we follow that down, we pick up the part of the radial head. In normal individuals, again, there's not significant amount of fluid or synovial areas. You may see some normal bursal collections, but most patients will not have much pathology going on unless they have a significant amount of disease. So if I freeze that image, here you see a portion of the humerus, and then you go in and look at a portion of the radial head in a longitudinal scan and extension. We just performed the lateral longitudinal scan in extension, and now we'll next perform the lateral longitudinal scan in flexion. Remember with the elbow, when you're talking about the lateral aspect, the thumb is where the lateral aspect will be, and specifically focusing on the lateral epicondyle from the humerus. I like to perform the exam with the elbow completely flexed and following along that lateral surface. Being sure to keep the orientation of the probe and identifying your bony landmarks. In this region, because of the sharpness of the elbows, you might have some fall off and getting some areas where there's not much signal, but you still can actually capture those on the image. Let's now look at the elbow, the lateral aspect, and a flexion. So what I like to do to perform this examination is have the patient to extensively touch the other shoulder. What that actually does is open up the joint, looking for areas where there might be fluid accumulation or for synovial changes. Be sure to keep the orientation of your probe, so you should have the proximal portion that should pick up the lateral aspect of the humerus, and the distal portion should be able to pick up the radius. I've also adjusted my focal point so it gives me a maximal ultrasound beam right in the area of interest. What can be visualized here is going to be the humeral head, the joint space, the hyperechoic region of the fat, and portion of the radial head. And let's see if we can capture a better image of that. Since the portion of the transducer is off of the skin, we have to make contact and essentially just shift the transducer to follow the contour of the radial head, and it begins to bring out that image to make sure you're not missing any bony changes in that portion of the anatomy. And this captures that image, the humeral head, joint space, the hyperechoic fat, and then the radial aspect of the head. Unless patients have had some significant trauma, there shouldn't be much pathology there. We will next now look at the medial longitudinal scan. So again, remember to keep your orientation. The medial aspect is going to be on the side where the pinky is, and that is where the ulnar runs. So, the bony landmark should again reveal humerus, and then you should pick up portions of the ulnar head. And the main reason to do these scans, again, to maximize the space of the joint to make sure you're not overlooking any pathology. Many patients will be symptomatic in those regions and actually will tell you if they're having pain or other changes. And let's just identify those structures. As you focus in here, you'll begin to see portions of the humerus. This is going to be the fat, and as I scan down slowly, begin to pick up portions of the ulnar. You can see the ligaments that transverse those areas to help to stabilize the elbow joint. And finally, let's talk about some of the clinical correlations regarding the ultrasound of the elbow. As with other articular surfaces, you may look for synovial changes in patients with inflammatory arthritis, such as a rheumatoid arthritis. In those cases, you may also see some secondary effusions around the joint spaces and also surrounding the tendons. Rarely, but you may find tendon ligament injuries and tears in patients who have elbow disease, especially secondary to inflammatory changes. Olecranon bursitis is very commonly seen in patients with elbow pathology, whether it is due from septic olecranon bursitis or from a gouty tophus or from other changes. Bone pathology may rarely occur in the elbow. It is usually a secondary cause from an inflammatory arthritis, but you can identify areas where there's osteoarthritis with joint space narrowing and bony spurs and erosions in the case of inflammatory changes. Calcifications and crystal deposition may also be seen as well. To summarize, the ultrasound evaluation of the elbow is key to monitoring and evaluating patients who might have elbow disease. The take-home message involved in the ultrasound scans will be the patient positioning, knowing the standard scans, and actually performing full extension and inflections of both the lateral and the medial aspects of the elbow. When possible, you also want to do dynamic evaluation of the elbow And also remember to scan the elbow and its structures in both the transverse and the longitudinal orientation.